Baptist started as a hospital of about 150 beds in 1912. It's grown over 100 years to a system that has 14 hospitals. We've got numerous ancillaries. We have recently built a freestanding hospice house, which is one of the only inpatient hospice houses in the Mid-South area where we're located. Our supply area for the corporation is operated from a central location in Memphis. It's responsible for serving that entire 150-mile service area all the way down into North Mississippi, East Arkansas, and West Tennessee. We're under a lot of pressure from the federal side, from the state regulations. One of the biggest areas that is a challenge for me is maintaining reimbursement. Medicare and the government continues to reduce what they pay us, commercial payers continue to reduce what they pay us, and at the same time, on the other side of the equation is expenses and cost. And so we really are focused on trying to figure out how we can manage our cost.
VHA PriceLYNX is it's an application that gives us accurate data with the history behind it that we can validate as we go to the table with the vendor, and information we can present to the vendors that will eventually result in a successful negotiation.
We are comparing hospitals or healthcare organizations' price performance against more than 1,600 of the hospitals in the country. We provide a robust solution that allows them to look at their individual pricing performance at the item level or at an aggregate levels to help them identify and assess what their pricing opportunities are in the marketplace.
The ability to drill down in the data helps us to negotiate more successfully with the vendors, because now we have credibility and we have more things to discuss rather than just asking them to lower the price.
The first time I got a report out on VHA PriceLYNX, it brought forth a significant opportunity. And as in the past, I immediately questioned, what's that special situation? How can someone be getting a lower price than I when we buy 3 times as much in volume? So I then went back to the VHA advisor and asked him if he wouldn't mind sharing the detail behind those numbers. And quite honestly, I expected them to come back and say, well, we really can't do that. But I was quite surprised when he came back and he said, sure.
What we did on the back end here on the VHA Advisory Services side is we actually did some more market comparisons. I was able to go in and do the market intelligence information for them to actually help them provide the breakdowns of here is how you stand compared to other players in the market, other healthcare systems who have been successful at different levels.
So in a matter of hours, I had the information I needed, sat down with that vendor, and successfully renegotiated our agreement. It's reached to the point where we're making the vendors aware that before you propose a price, check it out at your end and quote me fairly, like you're pricing all of my competitors and peers out there with like-sized institutions, because we do have the capability to check that price, so don't waste my time.
We put more tools in their toolbox, more arrows in the quiver, more resources within their grasp, so that way they could actually go back and say, we have a lot of confidence in this data.
When you have facts and you have the root behind the data, there's not a whole lot to argue.
What PriceLYNX has done to us is it's opened some doors. It's allowed us to be able to talk to other peer groups or either to other vendors that we weren't able to get to before, and that's helped from a transparency standpoint. We have a little more open communication. We're able to exchange information that helps, I think, everybody in being able to come to better pricing.
PriceLYNX has helped us reduce our expense across 4 manufacturers, 3 product categories, total of about $2.3 million, and that's just since January of this year.
VHA has been a partner with Baptist for a long time. A lot of times you think of a GPO as just being somebody that kind of goes out and contracts on your behalf. And they do that, and they do a good job of that, but at the same time, they have really been there when we needed them to be there to help us think through different strategies. They brought tools to the table that have helped us along the way to help control the costs.
Having VHA PriceLYNX at my disposal gives me the confidence I need to sit down when I negotiate with a vendor.
It's more than just PriceLYNX. It's the value of the services that people receive through the subscription. So it's the online solution and it's the advisory services team. So PriceLYNX is a solution that actually provides phenomenal market intelligence.
VHA PriceLYNX has given us credibility and validity with the cardiologists. So today, the physicians want to be partners with us. It's a new culture for our relationship with our doctors. And when compared to their peers, they want to be comparable. It's a new day. We have to run the hospital as a business. We just can't buy things like we did in the past.